How long can you live with a herniated disc? If you've been diagnosed with a herniated disc, you may be wondering, how long can I live like this? Will the pain ever go away? Is this permanent? You're not alone, and the answer may be more hopeful than you think. So let's talk about it. Hi, I'm Dr. Jain, an orthopedic spine surgeon. I've treated hundreds of patients with herniated discs, some with minimal pain, some with really severe pain, and most of them live full, active lives. In this video, I'll break down what to expect, how to manage it, and what recovery really looks like. So let's be clear, a herniated disc is not a death sentence. Most people live with one for years and even decades with little to no pain. In fact, studies show that up to 30% of people with a disc herniation on MRI actually have no symptoms at all. The key is how your body responds and how well you manage it. Pain happens when the herniated disc material presses on a nearby nerve. It's like a pimple that squirts out from the disc material in the middle of a disc. This triggers inflammation and nerve irritation. If the disc is herniated but not necessarily impinging on nerves, or if your body adapts well, you might actually not feel any pain. We actually really don't understand very well why some patients experience pain and other patients don't really have as much pain. Here's the hopeful part. Sometimes, and they say approximately 25 to 30% of the time, herniated discs actually shrink or resorb naturally. Your body has mechanisms to reduce the inflammation. Importantly, keep this in mind, the disc shrinking or reabsorbing is actually not what's important. What's important are the symptoms. The majority of patients experience improvement in their symptoms, even if the disc doesn't shrink or resorb. With proper care, symptoms often improve significantly in 6 to 12 weeks, even though recovery can take longer in some. So living well with the herniated disc is absolutely possible. The key is to stay active and avoid bed rest for more than a day or two. Build core strength. We know that stronger muscles actually offload the pressure from your spine because they're considered dynamic stabilizers. Use posture wisely, especially when sitting or lifting. Avoid activities that worsen your symptoms, like repetitive bending, twisting, or heavy lifting. The reality is you're going to know best what triggers your symptoms better than anyone else. Most people go back to work, exercise, and even sports with a disc herniation with no surgery necessary. Surgery is rarely the first step, but it might be a good option if the pain doesn't improve in 6 to 12 weeks with non-operative care. You're experiencing significant weakness or numbness, or in very rare cases, you lose control of your bowel or bladder function. And actually, that's usually a trip to the emergency department. Procedures like a microdiscectomy, for example, can offer relief when non-operative care fails, but most people do get better without it. Remember, chronic pain can affect more than your body. It impacts your mood, your sleep, and your outlook. So if you're feeling stuck, anxious, or frustrated, that's completely normal. Consider talking to a mental health provider or joining a pain support group. Your recovery isn't physical only, it's emotional too. So to recap, you can absolutely live a full life with a herniated disc. Many discs improve with time and non-operative care. Staying active, strengthening your core, and adjusting your habits can help you thrive. And surgery is an option, but it's definitely not the only one. And with the right approach, you're not just surviving, you're healing. If this video helped ease your worries, like it and share your experiences in the comments. What's helped you live with your herniated disc? I'd love to hear. And don't forget to subscribe. We're building a community focused on spine health and recovery.